Lepp, State Director for the March of Dimes. Thank you all for being here. Newborn screening is a critical public health function that is at the very core of the mission of the March of Dimes, giving all babies a healthy start in life. In 1963, March of Dimes funded research that led to the development of the newborn screening test for PKU. 50 years later, we are proud to still be at the forefront of today's newborn screening milestones. Today, we are all gathered to celebrate the addition of critical congenital heart disease, CCHD, to Alabama's panel of newborn screening tests. The work group assembled to develop a protocol for CCHD screening included parents, legislators, hospitals, and medical professionals. Today, we'll hear from Yvonne Willis, a nurse with Baptist Hospital, and Mark Miller, father of Mary Beth, both of which are wonderful volunteers of the March of Dimes. Yvonne?
As she said, and thank you so much, I am here representing Baptist East, which is the hospital that I work at, as well as Baptist System, and all of the rest of the hard workers that were on this work group to make this happen and add this CCHD screening to our newborn panel. We really, really appreciate most of all the collaboration of decades of hard work from organizations like the March of Dimes, our local chapter here, represented by Ashley Gorham, as well as the state organization as well, and the strong connection that we've had to the Alabama Department of Public Health to improve the lives of the babies here in Alabama. And it's been through this collaborative effort and commitment and just love and passion for these babies that we have been able to have early detection and early intervention and improved outcomes, and we're saving lives of our Alabama babies. And it's been under the vision and guidance and support of Dr. Williamson and his staff that we have been able to successfully add this screening for CCHD, which is, again, critical congenital heart defects, to our national panel, and been able to just see miracles happen because of that. And as she said, our work group focused on many things. One of the biggest things was the education that was needed to educate everyone from the physician level to know what to do with that information when things are discovered, to the nurses who worked really hard to find ways to implement this program, all the way down to the parents once a baby is diagnosed. Like, where do you go from there? How do we educate those families? How do they follow up so that these babies successfully grow up and have productive lives? Some states have made this happen through mandates. I'm happy to say that our state, Alabama, Montgomery, we've done it through just our love and commitment to our babies and our commitment to providing just the utmost of the best patient care to not just the babies but to the mothers as well, so that they have great outcomes. And in the NICU, which is my background, I'm from the neonatal intensive care unit at Baptist East, and it's a different scenario in our area. When we have babies come through, they present themselves with specific symptoms. They have specific backgrounds and health issues that help us to focus in on treatments, and we see miracles every day in the area that I'm in. However, the majority of babies don't go to the NICU. They are in the well baby nursery, and it is through a different miracle, the miracle of this newborn screening program, that these babies, who the majority of which have one of these 30 disorders that we're screening for now, they come symptom-free. They come into this world looking completely normal and healthy and like there's no problem. So if you didn't know, you wouldn't know. And if we weren't screening for it, we wouldn't find it. And so it is just, it's just with pride that I represent the hospitals and our community and the work group and parents who have had babies that have been diagnosed with problems, and those in the future that will be diagnosed with problems, just to thank Dr. Williamson for his efforts. And, Baptist East and all of the hospitals are just really, really proud to be a part of that effort. And thank you.
Thank you, Yvonne. I would next like to bring up Mark Miller. Mark is a vocal advocate, tireless volunteer, and in his free time, he's also a financial advisor. But the defining role of his life may be summed up in one word, and that is father. Mark.
Thank you. I want to go ahead and acknowledge the March of Dimes American Heart. Also, Representative Paul Lee, who couldn't be here today, because they're the instrumental ones in getting this passed. And wanted to get that out of the way, because having a heart child is different. You live your life every day wondering if today is it. Mary Beth's initial diagnosis when we were in the NICU was they didn't think we would make it past 8, and they were right. They had actually told us that we would probably be watching her through the window. She'd ride her bike down the driveway, have a massive heart attack, and before we get to her, she'd be dead. The reason behind this test is it's not going to cure anybody. It's not going to solve their problems. It's not going to make their condition go away. I had 7 Father's Days, and I had 8 birthdays with my daughter. And all this test will do is it'll give people a chance to have the same thing. And it's a simple test. It doesn't, the nurses know how to do it. They know it costs the cost of 2 Happy Meals to run this whole test and to give a family a chance to have some of the things that we've had. I'm deeply indebted to Dr. Williamson and Representative Lee for getting this done. I know when we started and we got the working groups formed, I knew, because Mary Beth always had a purpose behind this. And I talked to Paul Lee in May of 2011, and by August of 2011, we were forming the working group, which in the Alabama state government is unheard of. And so I think everybody agree with that. But Mary Beth had a purpose, and that her purpose came true in June and is coming true today. These families in Alabama, they're not going to remember us in 20 years. They're not going to know Mary Beth. They're not going to know Paul Lee. They'll probably know Dr. Williamson, but they won't know us, and they get a chance. And everybody here is here for that. We're all working for the same thing, is to give everybody a chance. Give everybody a chance to have some Christmases and have a Father's Days, Mother's Days, birthdays, because when it's all said and done, we've watched family after family not even get close to having what we've had. We've had, in the last 7-8 years, 150 of our friends that had heart kids that have passed away. And some of them made it 2 weeks, some of them made it 6 months, some of them made it 10 years. And we can't make their condition go away, but we can give them a chance. And I'm appreciative to every organization that was involved, every organization that picked up the flag. Cindy Ashley, she worked tirelessly on this. I have to give her credit. Dr. Miller worked tirelessly on it to get this done and get it implemented. And I'm proud of this state, Alabama, because we were one of the first states in the United States that was doing this. We were leading the state. The information that was created out of those working groups has been passed along to other states because Cindy Ashley and her team did such an excellent job on this. And I'm deeply indebted because I told Paul Lee the other day when he called me and told me he couldn't be here, how much did you accomplish by the time you were 8? I can't compare to my daughter. She did a whole lot more than I ever could. There are children that will, because of this test 20 years from now, that will get a chance to be saved. So I would like to thank all of you guys, Dr. Williamson, Camille, American Heart, Melanie Briefforth, Gina. Thank all you guys. It means the world to us to have this happen today.
Thank you, Mark. I feel very fortunate to get to work alongside with you. The simple but important act of screening for treatable metabolic and functional disorders can make the difference between a typical life and a long-term disability or even death for infants. Dr. Williamson, you understand the importance of prevention and have acted on that knowledge by supporting the newborn screening panel of treatable conditions, identified by the U.S. Secretary of Health and Human Services and endorsed by the March of Dimes and the American Academy of Pediatrics. With the addition of CCHD, Alabama joined 21 states that require and implement screening for 30 conditions. By detecting a problem right away and getting the baby into treatment, many families avoid the unnecessary tragedy and the many costs, personal as well as financial, that come with it. On behalf of the volunteers and the staff of the March of Dimes Alabama chapter, and especially on behalf of the more than 60,000 babies that are born in Alabama each year, thank you, Dr. Williamson. I'd also like to thank the Bureau of Family Health Services, the dedicated staff at the Bureau of Clinical Laboratories, the Newborn Screening Advisory Council, and of course the CCHD work group. I have a small token for you, Dr. Williamson.
Thank you very much.
Thank you for everything.
Well, on behalf of the department, let me thank the March of Dimes. Let me also thank our partners who helped make this possible. Parents, physicians, teaching hospitals, volunteers. Let me also thank the staff at Public Health, the work that Dr. Miller did and his folks in Family Health Services. When we started this, I gave them an impossible timeline, and they met the impossible timeline. So that means in the future I will shorten my impossible timelines. But what they did was they took a test that fortunately was being done already in many hospitals, took it statewide, and we started a voluntary process. And we ran it voluntarily for almost a year. And then once we had wide penetration, we made it mandatory in mid-June. Let me tell you how important this test has already been. Of the babies that have been born, since we started, I think our first screening was in August or so, in April of 2012. This test identifies 7 primary cardiac defects and 5 secondary cardiac defects. Now, as you've already heard, all of these are not going to be curable. Some of them are. Some of them with surgery in extraordinarily skilled hands, we can save lives. But so far, we've already identified 4 infants with primary defects and another 6 with secondary defects. That's 10 children, some of whom will live a normal life because of the screening, some of whom their parents will have more meaningful time with them. So, on behalf of the department, on behalf of all of the folks who worked on this, thank you. And let me especially thank the State Board of Health, because it was through their wisdom to allow us to make this mandatory and their approval of the rules that we joined those other 21 states and make this a mandatory newborn screening test. So there's still work to be done. There will be other tests that we'll be adding, but as we're able to identify our youngest Alabamians with problems and intervene to make their lives better, we're making the future of Alabama better. Thank you very much, and thanks to the March.
Thank you again for everyone for being here today. We're very grateful.